dé hianna tú ma va tinnes ost nach enemichich dunne.
Myalgic encephalomyelitis.
Chronic fatigue syndrome.
Low natural killer syndrome.
Post-viral fatigue syndrome.
Dé ma vau choskis nach kude tú cas es bialo cas, no nach burgut fuse glanischke all.
Ich mi vader ging schütz na route na cool mafi ich hat doch man guru bar ioren is guru kuchig in a jiege a cool dafich.
Gaat dan ik het jewelas, mijn nest, mijn waai, maar staan ik shoharam ieder.
I can't think of a disease which has quite so many names and which doctors and patients cannot agree on a suitable name for this illness.
Tapanui flu.
Chronic infectious mononucleosis.
Yuppie flu.
It's the relentlessness of it. I mean, it's like if you had a paper cut, well, paper cut, right, you can deal with a paper cut, it's not very nice. But if you had paper cuts every hour for the rest of your life, boy, it would get you down.
Atypical poliomyelitis.
Royal free disease.
I often talk about the toxic awfulness of ME. That's the fatigue doesn't come anywhere near to describing it. It's toxic, it's like toxicity in your bones and in your muscles, in your head. And I don't mean that in a psychiatric way, it's toxicity, toxic awfulness.
Iceland disease.
Akureyri syndrome.
Post-infectious fatigue syndrome.
Om krijg fijn gaan dokteren, kan ik weg naar een later down, is MI. Waar nu dat kon je als je fick het blein, maar hij fick het blein dat.
Agus dé hianna tú ma rá dochter dagat a critchin nach rá lay down.
One woman in Edinburgh years ago told me when I tried to join her practice that she didn't believe in ME. That was kind of a slap in the face when I'd had it for, 12 years, so I just didn't join her practice.
Some people are getting an early diagnosis, an accurate diagnosis and good management, whereas other people, if their GP doesn't know about this illness, perhaps doesn't even believe in this illness, are not getting a diagnosis. This is a major scandal for the medical community.
Haar het toermsje gewil chorus kastel a vil nech as a riach unichte a fulluk latinus id wil ME. No Island skis lentenjach. Hanjelis haka overig. Hanneke dinjes id Allison, maat a fuidach an de leeuwers, gehoppen.
Maar ik op het in hospital, she banaltra me hunne, ergens, was een gematrang, ergens. Maar een hoorsigje roet, zo'n mischkera hoorsigje en trippelage, van mij ela le stamakost, ergens kom ik pilletje net gewoon, net kom ik zo, gas me gemaakt catalog, ergens, kon ik in huilig mee, nam catalogs wat verjaaging nam ruisker, sapori met ruisker, ergens net de ruisker met me jeder, hoorsigje meer kaal. Agus hapúri mi tjana kar ma yin.
Va Sean eilenis na allanach beoghal do de gas atin.
Va mi tjera getjenef nihin mar a savisteach, va mi fein gan ro kosioch agus rui agus nihin mar seo bekken na store agus gan ro mi djichnachig nihin agus ronnechen va Keine kerskeleir acham, ach is Jason van mij, jeichnigig nihin agus, bescrutig bekken is dorre kutjoch.
Shellige tjollig je has a dochter Sarah maar, ach hij kutjoch gemollig kungi en leggisch latere.
Toen je voelig le ME, had je nora tjiddig aan de bedipper na solen, but is trichke ha chinora ije virus hodiken if you're kartidach auch gost na Rodiken karsurig marshin ag san la vinach hanil lúnda hanil gynach gefalaf agus hat geslútach man húle sían there's the brin du húle te crojechara
Va níal a balantóir an tú sé rois na follisman door hug MI a griach go krich.
Laatste van mij gobber als office na Polish in er fjoran. Agus en ik put bak de lood aan aram. Wat aan had de hesa kleate. Sit horken la maar gemasse goes. Na la en ik neurut aan me diestje wat kema na smis na hietla. Agus aburgo wagen we CCS agus eeuwige kudjigen in zo'n kudjachig. Zo'n chief inspector goeda zo'n dokter, een dokter, agus een injection, agus a station hoe dat de ambulance, agus van mij als een ambulance, en een jeppie. Van mij als een jeppie, zo'n schach in een station.
Well, there was nothing wrong with Neil that morning that he took ill. I went to work. He went cycling to work. The next thing I knew, there was a policeman at my work to say that Neil was taken ill and had to go home. And he took me home too. And I honestly couldn't believe when I saw him. He was so sick looking, pale, white, and just lying there. He couldn't open his eyes because the room was swimming. So it was a big shock.
Had the cold hulaska interest as a dachis chewlich solishian and you're a kiri or a lepi agus cattle agus dúsku lepik an yersta hurricane agus haniltunya tikshin chimera shaw tachast.
Ha Nassim skrivige at den etjon er vi fulluk chorus fichet bliana.
I was 19 years old. This was September 1982, and I'd gone to France as part of my honours degree. I was doing joint honours, French and English. And so I went off to France, really happy, really excited about my year abroad. A couple of weeks in, I started to feel incredibly unwell with this very severe gastric symptoms, and my eyes became very sensitive to light, and I felt dizzy. I didn't feel real. I had a pain in my side. So this went on for a couple of weeks, and I ended up seeing a doctor there because I thought I might have appendicitis, and they couldn't find anything, and I just continued to get more and more unwell.
Agus va Kim a siarach yn frisch na niachgráich sydefachal, no de glúis le heolach as a bhile bhór. Agus san an nóirsan a hug go bhain an laide nach ráláinte chun massa bachár.
It was my wife who turned around and said, well, look, you're not yet 40. You've thrown off a stressful job. You've been eating healthily. You should now be much fitter and healthier. You shouldn't be constantly needing an afternoon nap, constantly falling asleep during documentaries. Something's not right. Go and see the doctor.
Maar hurst dunne gova jirach maar koshach troch rechgal agus besit jirach maar va mishe ferch gen urinen urinen gevuge rodan agus burin go opereren vek en al hij burin go koshach shies gunnen al hij ach urinen va rogar of fus koshach gasen tai.
Have je skieset she nost even again at the night just toch she va is she buali au as I'm so going post exertional malaise had to get out I guess I'm just skis who have socks hold the car ha na muscle sesna and caught by the yemal I guess hold the car gave a grut Joch man grau maybe látrang as a búne ach har oidianu, you know, car mosún.
Sé Tiredness has a chuman ME a ha cochtiochu as leichlwch fúlach. Sé dochter Charles Shepherd yn gharliche medicachachke.
Most people with this illness are previously fit young adults, 20s, 30s, 40s, and I speak from personal experience here. I developed this illness in my 20s following a viral infection. And what they tend to report is that they've been perfectly fit, they get an infection, and they don't recover from that. Although the infection itself goes away, they are left with these very characteristic ME symptoms, which are basically muscle symptoms. They have exercise-induced muscle fatigue, they may have muscle pain, they have brain symptoms, particularly problems with balance, memory, concentration, temperature control. And on top of that, they have sort of infective flu-like symptoms as though they've got an ongoing infection going on, and they just don't feel well. They feel very under the weather.
Hadioch da hwyl yn ei teachum, you know. Har oes ei defa tachart, fadioch. U afasochs. Y laire yn couch, y hwla las, y hwla trapigach ting ysdiach, a bwr yn yw cymryd y llawn suas, because far o rhawn, hym chwydioch. You know, gyda llawn y clwas ac ys. Hynny'n sŵr yn tig dinga, go ffink gyda.
Chai yn doctor yn harwad man yma cwysyn harwad dyna mach defa car ach am y tics van de ocean gre grodd y son o hwla genius ele hwla mach hwla gan lawn y tŵ mas bwra gai fe diagnosis gre ME an jo sy'n y fawn.
Ek yn tosioch van gewoon dochter is mynich yn ro cael tromchwsioch cer orm. Gebeuring je cael ein va cerlawn. So geroos een kindjoch je begorig.
Hadioch palach gyniw afasoch. Ged nach rosa môr ma jen, ma me graf. Hasionis cutra mich niw. You know, am I smyniochs. Am I just mae'n rwyd yn ma'n meningitis yw'ch dy siachadydd. Rwyd yn acute, chan i rwyd yn y hesach fata. Ach yn y doctor yn ac ymhyn, har o iad yn gywr i cwth ME, gyrwad gyrag yn ME fa ciar ar am, cos had y gyrag y ffim i fi si am i asyn, leis yn tryplach, mas canad gyfel ME orst.
Ma faher y gynsigo gyn dy hwyl eisiau gyn ro ME acym, ysgas gyn ro na soinich yn acym mar y fechge mar y fa ME echge hyn. Ach ar o'n doctor cyntiach.
I mean, I started feeling ill September 82 and I wasn't diagnosed till January 84. So, I mean, that's a long time to be ill and not know what's wrong. And that's when we then heard this very strange word, ME, myalgic encephalomyelitis, which we'd never heard of. And that was really the beginning of my life being changed forever.
And things just seemed to drag out forever. And eventually, CFS ME came up in conversation. You start off with this sense of, well, okay, what is it? You go away and you look it up, and there's this notion, well, there isn't a cure, but some people just seem to have it for a few months and then they get over it and everything's fine. But nobody actually really knows what it is.
We missen een groot paardje cooperative aan. We missen dollarage, dus een minigug naar niet in een verkeerarm. Een groot is je no hele royeel raadgerem van. Er gas nog heel immig duine gehuxen. Als er gasjen genial duine is een diagnosis a yen of rollen.
2 days later, the doctor came back in, and I'll never forget what she said. Neil wanted to go, was wondering how long he would be at home. He had never been off work. And she said to me, I don't want to tell him. It may be 6 weeks, because he has a very bad case of labyrinthitis. So we'll keep that to ourselves and wait and see. And I'm glad that I didn't actually know that he would not ever work again. So, hard times.
Ha fi lorak over son ME, no gebitich an ystudis, dydaf agus lef de gochtadden agus Islandich, on a chalduine gyntachig na coren.
Hiring na gro torsausje acham. Gro een dochter is een bruinere gusper kuus. Ha visacham geveel dochteren aan een atje genele gema eilig na tripletjen kengelstje die ME agus kengelstje die na virussen ter heiligje. Ach gose gedur me tor vissergie me een. Een vissergie huur me vo karstenacham agus deine mar seo. So groe medicach agus groe academicach. Ach hiring geno a practicach agus ve eilis practicach acha a huvenchinish.
A general practitioner diagnoses any disease on 3 bits of information. Basically, the history the patient provides, what he finds on examination, and what he finds on blood tests. And it's not very different with ME. So if you have a patient who comes along with these classic muscle-brain infective type symptoms, you may not find very much wrong on examination. You do a range of blood tests to exclude other possible causes for fatigue-like illnesses. So you check patient's liver, kidney, thyroid function, these sort of things. And if they are all normal and you don't have any other explanation for the symptoms, then you can normally reasonably confidently make a diagnosis of ME.
Agus ha noorsan een tripletjan, chosent die dochter ach keen. Me gochtadden a har or hang, a vi avarasach, moet die ha fonjer, gan goed Islandich.
Ha fewin de gúne aha lisk as an átarachcha agus discal sa bír son stata gúpid casnach go chursúas agus béach chur seachat an a dói liskas na chémat a bhí John O'Mass an úpid achas Taraketjen srútan mar sin. Hat tíoch opte gemach. Agus sánig an a dochtadden na njóne sin. Agus hat dydaf úan an tjanúmach coed a ha genius ME agus co ekki vil na liskalan. Agus as a lána djú hanjel lúnjak na dochtadden a vi potrik iglisha sin.
Ach dees dagen a dripletis misset de lok voeluk. Hij kolloch nach el moren gochte den a kritchen al ME as a hierdaad.
Am kretschkel fein gan dokteren gan weg nach el later down is ME. Waar nu dat ko you as in fasker fikket blien mal ha fikket blien dat.
Certainly when choosing new GPs moving around, I've always been very careful that the practice I join that they are aware of ME and that they believe in it. You know, I have gone for pre-registration consultations, and one woman in Edinburgh years ago told me when I tried to join her practice that she didn't believe in ME. That was kind of a slap in the face when I'd had it for, 12 years, so I just didn't join her practice. But it just shows you kind of what you have to deal with.
Even when people are presenting with very classic symptoms with this illness, there are some GPs where they're not making the diagnosis as quickly as they should be doing. So some people are getting an early diagnosis, an accurate diagnosis and good management, whereas other people, if their GP doesn't know about this illness, perhaps doesn't even believe in this illness, are not getting a diagnosis. They're repeatedly going back, being told all your tests are normal, I don't know what's wrong with you, you've probably got depression or something like this. And they are going for months, and in many cases, in this category, even years, with no diagnostic label round them, no help, no management whatsoever. And this is a major scandal for the medical community.
Wel, ha mis mewn i chi gyfel angelas elm a hwf ME. Ach, ha mis mewn i chi ag yn nhw'n elm, na chael dyna sy'n aniachig gyfeil emi na fir replit. Agus am ys mynd i'ch gyda sydd as corach gyfeil arcymit agus triplit yn acin. Gyfeil dynia gra gyfeil emi achgas ach gyfeil dynia ele chwydje medicoch y gra na chael emi iawn eacher. Agus gyfeil a dolas eichich gyfeil rwyd sy'n bi cer o'r. So am ys mynd i'ch gyda sy'n y bychorach.
Hwle dochter had y gyri dynia gystais fydd o gaif bilen a rwyd i cynelas falaiad sa dy fas na siar sy'n hwle dochter y gyri. A codos o hi cwtgyn ystoi agos mrystrich sy'ietjes caniad chanilus am ca dosich mi. Pydwch chi y twchtas fe o gra, o, sio cwtgyn le emi, a sa isagyd gyda dda miasach yn fwr y ffata dylig yw ddiw y fiach yn di brosnoch yw son fa slan y ddysg. Ha dydaf.
Chanile na unig ma ha gybyl dylietus y lwyb mar y hyd y lainsach. Chanil dan man doi cast. Chanil dryga no leis y gobrichus gycintiach. Gyda iemas dochtadyn rwtigyn iachin.
Well, they're quite happy to give you the antidepressants, but the antidepressants don't make the tiredness go away. I think a particularly low point, even on the antidepressants, was actually when I decided I'd been on them for 1.5 years and I wanted to come off. And I saw the doctor about that and he said, well, why would you come off them? I said, well, you can't stay on antidepressants forever. I said, well, why not? You know, if your alternative is just to feel like crap, then, you know, even if you don't like particular side effects of the antidepressants, then surely that's better than feeling crap. So I stopped seeing that doctor.
Sefferchen y doi yn ysbychante rwtys yn canner lesachach troi echgysich rangichte no graded exercise therapy. Fara veledioriad Islandich bekan y farach echgysich corpora y gianw.
Ba consultant vacum. Wa gishu ruten yani ruten nach behorge yanaf. Dus man wasni ga gara kulte dus tegalig het energy gala man poke wan man pokeid wan I like it. So man like it sin nou ga gehef. En het kala akal as fok skill energy level side en nu de origin man kan kus en het kala akal ik telig law. En so sin man put the vakra wat in op kielklior. Har kärste agoi var kärste agoi har att då gälla väl fem det kamal pagan exercise yanaf nama så man måste man ha ju man gärna kall man håller gärna sen bit man zombie hus and rot kall italiano.
There's much talk of graded exercise, where what you're supposed to do is find a baseline of what you're capable of doing and then very steadily, slowly increase it. And maybe that works for some people. It didn't work for me and it doesn't work for a lot of other people. All that happens is I just get exhausted. I've got a limited amount of energy, and if I go over that, the plug's pulled out and I collapse again.
All these years of having the illness, my experience is the only things that can truly help are resting, and pacing yourself. Overdoing it, you will get worse, and that's my experience. I've become so much worse when I try and get back to some kind of semi-normal and end up bedridden again. So yeah, I haven't found anything that's cured me, and I'm very, very suspicious of any treatments that are touted as being curative, because I don't think there are any.
One of the things I found is 10 minutes is manageable, 11 minutes isn't. It's this notion of you step over a line and you pull the plug out. Maybe, I mean, one analogy is almost like, imagine you're attached by a cable to the mains and you can walk so far, and when you get to a certain point, if you go too far, the plug comes out and you lose the energy and you collapse.
Chanil me crutchen on the physical therapy na pavung Humes rút ha as a húlatunni de vel mi hat dúna na fiachan a teen ein na sér as hiútrút is at the chian se fiachan de koshach na satche barach exercise ianus hat kabuchtug heen as mir a smúa fúchtas at a teen sam smisse gases had Humes fyrir a trí lá fein shachat id bout the exercise.
Ach, son kutgeta ha echter sich rangichte a kutjachug.
Han vi smunnig greie en determination of acum a vi a dol fewis greie sinna hug corgo an an dai Gehari der var mi het luchig die jirrigen term van mi fein gudro wel de gro kus ac am yin of jirrigen term agus geburing go becken tuig ecker sich a yin of gach la geburing go koshach becken tuig kutjach ach gus jirrigen term agus a station na heim yachi geburing go jirrig foshegal agus geburing go focus yin of dolan fewis.
I wouldn't be at all surprised if there are several different conditions, which is why there is no one cure-all. For some, there probably is, it's triggered by virus. For some, it is more psychological. But it could be any number of things, and it's why graded exercise will work for some people and not for others.
Agus kutjach ha CBT an, lesachach giul an leersinjach, no cognitive behavioral therapy. Da je het a chlechgus an immetach triplet, wo vi smach kjarigus getraumientjen. Gesannach begefdikkerach er son ME.
I think there is a patient population within this spectrum who have a psychological, psychiatric element to their illness. So it's not surprising that psychiatrists have got involved and got interested in this condition and developed therapies which they feel are effective for some people under this umbrella, including in those being cognitive behaviour therapy, graded exercise therapy. So I would not dispute the fact that there are people under this umbrella who, if you like, fit more a psychiatric picture than a medical, physical picture, and that psychological, social treatments may be more effective for that particular group under the umbrella.
Cognitive behaviour therapy ha bwy eich sin cwtsi hi a fewin ach jarach a chanat tu hala agos kiko cwtsi na chanu cognitive behaviour therapy of spiota the hanil sin kerstiches cwtsi hi a rutbig a chanil alias.
I managed to get a course of CBT, cognitive behavioural therapy. But it's not a cure, it's a management strategy.
The peculiar thing about ME is it's a neurological illness hijacked, in my opinion, by psychiatrists, especially in the UK. They've decided that whatever triggered it, maybe it was a virus, maybe not, there's false illness beliefs that are perpetuating it, and that is nothing actually makes me angrier than reading about that, and I would like all of those doctors who don't believe that it's an organic illness to get it for a week, to have severe ME, be bedridden for a week, and they would soon change their minds. I'd like to see them then doing their graded exercise and their CBT.
Maar zijn kun studig vollasjach van gaiasnach wedigach, ha moran isantich a ronige en schlie heen gal.
Because of the fact that doctors don't have the tools really to treat this illness, the management of this illness is very much left to the patient. So it is very much along self-help lines that patients are asked to manage their illness.
Maar ik maak natuurlijk niet wat mij voor moepet, because hij valt in een hamel, dus han je lugurie dingen, is mij nog een klaar oors, dus hij kan je hem trappen, wat mij fall af, kon cheat woord, is zo'n fan, treatments, ja kan je hem jaag met homeopathie, dus acupuncture, dus aloe vera, herbal medicine, een hele kaart moet doen.
Nee, dat er een she gaan me zoals go galf go herbalist en machine. Agus ga waar hij hoe gaan ons toe zo'n een huis van naar mijn dorp. Agus pakken is pakken een chin fame. Agus station waar kan be medicine zelf go al van dokter te go. Agus she aspirin a gewarke de sin had me treat me diger ach wat dokter voor een dokter ga go beta blockers Agus had het films be filming hinjes ik kamal man bear burio a chuam feich voor me wen scan me wen we gematulich kamal tal agus rani man was at a grad job ma.
There's 10,000 people trying to sell you snake oil. Sleep with this crystal under your pillow and all will be solved. And you change your diet, you sort of try removing this from your diet and that from your diet and seeing if that makes any difference. Give up coffee. The problem is by the time you've exhausted all the standard treatments and going through the doctor, a few years have passed and you've used up any savings that you had.
It's not surprising that they go off to private doctors, the alternative and complementary health sector, who in some cases I think do offer treatments which can be of help, things like acupuncture, homeopathy, if you've got faith in it. But at the same time, there are a vast number of treatments out there which are highly expensive in many cases, very speculative, and in some cases are, I think, promoted unfairly and overhyped to a very vulnerable group of patients, because there is no proper scientific proof that these sort of treatments are in any way effective for this illness. They're all based on anecdote.
Ach de jimmetach neach fuluk ha kind legis efachgach a cruachach fadachkin gerepin bear has it hinnis.
So you're given this label, and now it's just go away and live with it. And for a while you just think, right, that's it. Oh, my life's over. I'm 40-something, and I have the energy of an 80-year-old. Is this it now? Is it one foot in the grave now, and for the next 20 years or 40 years or however long I've got? And that's soul destroying.
An the big and goon ye hika shachat lishin. Ach gutjes moju, ach gefat de bear, ach anay de ba sicherlish. Ach je la kunarstach machine, ach jara ha gushachat be ach kama uavasach.
The most useful thing for me is the thing known as mindfulness, which is just really it's a combination of awareness and meditation, and just becoming aware of your own thoughts and noticing when you're running off on a whole negative stream of, oh, this is terrible, and just returning and just focusing on your breathing. And that's very useful.
Je ha a gyfrach emi no Island skis lentenjach. Ha sio na jefadach do loch fullig agus dochtagan le chéle.
Anja me keintach de scalach yn horsige yn triplets arams ach gyda fi gan gwybag de stress am as nobod am i anaf ach warach gyda sy'n hannelisam mitjar.
The scientists are split. They don't really know what's going on. All different people think they know what's going on. They've all got their competing theories. I think part of the problem is CFSME is a miscellaneous category. As I say, chronic fatigue syndrome is a description rather than a diagnosis. So I've always felt the chances are it probably holds dozens of different unexplained conditions.
Doctors often call this a multi-system disease, and by that they mean the symptoms cover a whole range of different organs within the body. And so we have brain symptoms, muscle symptoms, and we have symptoms relating to the different organs that the brain controls. So there are heart symptoms, gut symptoms, bladder symptoms as well. And this does make it a very complex disease from the research point of view to home in on these different symptoms.
Sian bechgus cumanta gyfel yn tynnu sydd öfrach le bwy ystoi galad viral. Sian virus a tricht a fast y virus Coxsackie. Mae'r hwyl Sean y mach fo gochtad.
Nyr yma mi tîg hwchge y gynsio go na chro cwysyn y gachrach ag gyn rwmi hast ferchyn sgo ski safami. Hyrsti gyn gianach i virus screen agus leishin byrringin feinamach gre Coxsackie virus a vacum agurin.
Am hínas munjin cyfel viruses i the chwlw agus da virus awrys acum ferju se Coxsackie virus agus Dúine de bhfuil Coxsackie virus múte nach rúsachcha croadíomh as a chorpachcha múte bud big diarrhea a sinúlug ach díadach seachcainnes dúi sin hat go ski chacharacat concentrated bhfuil sían sa bí agus mar sin as virus ile agus amis mú cynnes tríchge héad cúlú ME sé a virus vis ag glandular fever. Chamis smúine cil na viruses a sin a fácal toxins as an null. As cne sin a fácal dúine de bhfuil ME go fír héin grot a fadachcin.
Ach a tór a varach go de Sean, ha rausach go sealt yn cael imig ílte idir y system gianach, yn janachin, agus opad na féhin.
We know that there are hormonal endocrine abnormalities in this illness, and that these probably relate to a abnormality in function in a tiny little part of the brain called the hypothalamus, which is a gland which sits below the top of the nose, deep inside the brain. It's only a very tiny little gland, but it's a thermostat within the body for controlling temperature, appetite, and it's the leader of the hormonal orchestra. So the hypothalamus, sitting there within the brain, sends chemical messages to all the hormone-producing glands in the body, and we know in particular the messages which go from the hypothalamus to the adrenal glands, which sit above the kidneys and produce cortisol, seem to be abnormal. So people with this illness have slightly low levels of cortisol, which is a very interesting finding, and one which is possibly amenable to treatment. I can appreciate from many people's point of view, it does seem as though we're dashing off in all kinds of different directions trying to find the cause of this illness. But if you look at it from a point of view of a cascade of events, you can see how these things might all fit in together.
Ach, sé druplet nach a lisek dunne, déan ástú as a gurat na bechgan smáinsin. Kit an döver, agus kit a bhuai.
Ha virus a seo ha John Rutkin iad an inochan ag dyn ag cersca leor a mis mynd cyn na toxins a ha sa nŵl ha dog an inochan agus mar sin ha feddach cyn depression a seo a fwr i hwyl y dynach ga pársge saliw a fwy a hec na toxins iad an inochan ach cwtioch gyda feddach cyn Cleveach gesiachad.
Tá torgan a doctor in hau cúneach a chynnu hat smynach gynnies yn ynaching a ha agus ha cain go doctor fwch yn gadage agus hwt ar aim bat janu sgrwdi yn ele hwt ar aim o chanel diagnosis ac yn gais go yw bys ond nach nyalat nyechin yn art le cael ele agus hútar na da fadachgin. Na nach mana dain bu fadachgin torpia an is de chor.
Is MA in the body or the mind? Well, it has to be in both in one way or another. I don't think the body and mind are completely separate. They are intimately interwoven. They are part of the same thing. When your body is playing up, it affects your mind. When your mind is playing up, it affects your body. Where it becomes upsetting, the idea that ME is just in the mind, is in the same way it's upsetting when it's like depression. Somehow it makes it your fault. Well, you just should snap out of it then. If it's in your mind, you just got to get the right attitude. And it's far more complex than that.
There's certainly something very, very big and very abnormal going on. And we feel it, you know, as patients, we feel it, we experience it every day. I often talk about the toxic awfulness of ME. That's the fatigue doesn't come anywhere near to describing it. It's toxic. It's like toxicity in your bones and in your muscles, in your head. And I don't mean that in a psychiatric way. It's toxicity, toxic awfulness.
What I think one also has to recognise is that people with any long-term, very debilitating medical condition that has a tremendous effect on their quality of life, as this illness does, are going to have psychological and social issues. They may well get depressed in the course of this illness. So it would be very wrong for a doctor not to also take into account and ask a patient about, are you depressed with this illness? Is it causing you psychological, social problems? And take those into account when the management program is being discussed. But for people that I would say have what I would normally describe as classic ME, neurological ME, I would say this is definitely not a psychological or social illness. It's not a psychiatric illness. It should be managed as a neurological illness. But if there are psychological, social issues there, then they need to be addressed as part of the management.
That idea that we somehow consciously have made it happen is insulting. And that's where it gets really upsetting. You just want to thump somebody in the face, really. Well, you would if you had the energy.
Dolach fulog sé chéistis cutramiche and ja tinnis corpora no tinnis intin a haun, no rutikin itter naga.
I think as the weeks went on and the months went on, I realised that Neil had no energy and no strength. So there was more to it than labyrinthitis. There were some days he was quite good and other days really couldn't do anything. Our lives had really completely changed.
I'm falling to maturi come a bad because hapuri mi giano cal, my father can joke and garlic me hula dingus gurumi, nam griech balochs. Ham is meer nach rufeinaun, stoch nach rutix, the siogheid. De wessen hinjes, so gro. Fijn te gaan stoch meer kan je skiezen van. Ons geval schöne de hula dingen. Ach, en je skis each the home. Ach pian lesje skis.
I remember talking to my brother on the phone, saying to him about it, and his first reaction, I said, well, I've got CFS. And he said, well, what's that? And I said, well, I feel tired all the time. Oh, don't we all? It's just your age, he said. Yeah, great sympathy from my brother. And for those who don't understand what it's like, then it's very difficult to get your head around.
Van me heldig gemeen hukzag lees na triplet in de wakken. We deden zijn cholig ellig een tripletje wakken. Zo bring geef jelke Grieks gemeen. Gebring do goed jeme garsten a huksen. Jirigers gasnig rooie tellen ellig een tripletje. Agus ekenalhei. We kutjene luchtgare chakam tukjach kutjach bringgeif emie huksen so huksen korgo ekanalhai.
At that stage sometimes people would say Emmy, what's that, you know, but they saw Neil the way he was, and then when he started trying to get out and they saw the change in him. They realised there was something wrong with him, really wrong with him. So, you know, it wasn't, I mean, even his walking was, his balance was unsteady. So, you know, I remember one lady one time saying to me, if I hadn't known Neil, I would have thought he was drunk when I saw him walking today.
The impact on loved ones is huge. I mean, the sense of guilt you carry at being a burden is terrible. I mean, when I ran my own business, I was the breadwinner. I was the one who was bringing in I was the one who was bringing in the income. I was driving a lot of things forward. Now I can't do that. My wife has been superb. It was fantastic. She's been supportive all the way through. And the kids have been great too. And I must admit, my son is wonderful. I mean, he's 16. Most teenagers tend to be more kind of much more involved in themselves. And of course he has his moments. But he keeps an eye out for me as well.
And I felt at times quite weepy, because I felt, and this is going back now, I felt, why is my life changing when I was perfectly healthy, you know, and we can do things together. So it was quite a difficult time, but my faith took me through that, and my friends took me through it. So it was a good time in the end, but it was hard, very hard.
Agus at sa hana harak metin mo over agus leis at all the worst. Gaan je roin ek je look fulluk ach a vi piaul is it.
For most people, this illness tends to be a condition which they will experience some degree of progress as time goes on. But, as I know from personal experience, you get to a point where this progress seems to stop. You hit a sort of glass ceiling, as it were, which people will often describe. They say, oh, I've got back to 60–70% of my normal self, but I just don't seem to get anything beyond that.
To begin with, you think, wait, great, you know, now I know what's wrong with me. I've got chronic fatigue or I've got ME. But then what? Well, then go away and live with it.
Hwyd Kim goro tokal gilef na chwtiachaga an a fi lorak driach gŵr na berecriche iddyn ni'r isbinieke.
After sort of feeling like that was it for a while, then there comes a point, I think, it's like you sort of wake up and go, well, I'm still not dead. I suppose I'm going to have to carry on living. And that's really where the photography came in. It's an area which you can have control over. And when you feel very much out of control of your life, having something which you feel you can take control of becomes very important. And I love faces. I love the landscape of them. I love the expression of them. I love the way people inhabit their faces. And my photography just became more and more and more honed in on faces. And so then I thought, well, okay, let's do portrait photography. And so I set up a portrait photography business. Now, it's basically part-time because I don't have the energy to do it full-time, but I can build it around my energy levels. I make sure that I do shots in the morning or in the evening. I build the business, I build what I'm doing around the lack of energy. And so this is my way of dealing with it, my way of coping with it. And, you know, things move forward.
27 years on, so 27, I get so mixed up. I still have ME. I've had many, many ups and downs. I describe myself now as moderate with severe dips. I'm no longer severe, I'm not bedridden. I'm probably housebound 2 or 3 days a week in that I can't go out every day and function and do stuff. I have to still very much pace myself. I feel like I'm like a constant calculator, constantly measuring out, like you were coming today, so yesterday nothing, had to rest all day. Tomorrow I'll be completely done in. So, but it's so second nature to me now. I don't even think about it. That's just the way my life is. And like anyone with any chronic illness, you adapt and you normalise.
Hwyd na sim cwtioch doi crwchal y chwtichil a fi sapat yn tinis, An y dafyn lys ymlwg, gael si chi chiad nofelechge The State of Me, adis wrskilach man vachtlich geheen lys yn hynnes.
I hadn't been on a bike for years. I knew that my legs would be ruined the next day, but I didn't want to let Ivan down. You can stop and rest as soon as you want, he said, as we got off the ferry and walked towards the Velos for hire. There was a hill right at the start. I'll never get up this, I said. There's no way I can pedal, I'll need to walk. Lean on your bike, said Ivan, use it like a Zimmer. Don't make me laugh, I said. I can't push and laugh at the same time. So I really decided I wanted to write about my illness, but I wanted it to be a fictionalised account. I did not want to write my story of my illness because that kind of genre of sicklet had been done to death, and I wanted a book that was accessible to everyone, not just people with the illness or carers. Sometimes I go to the careers office. I feel in awe of all the opportunities, looking through the toy shop window at treasures I can never have. Glittering jobs, glamorous placements, exotic master's degrees. I always check, but there are no jobs for 4 hours a week. I hope certainly that it's successful in that it gets the absolute hell of the illness across, but it's also quirky and there's a lot of black humour in it. It's not self-pitying. I didn't want, you know, some dreadful 500 pages of self-pity. People can get many illnesses. ME is not the only illness, but the thing that makes this illness different is the lack of belief and the misrepresentation, and that's what I feel extremely angry about still.
The nial had the gas cushion na bear itit.
A doctor in the Polish yn y growing son thing a nachal gyma agos chami ami eges yn ywedd na ga agos dyrys mae iel hwda haid ma hwda na gyrwffus ag am hun sy'n ddach nach bwrw gawalash gopydd y ddysg agos gaffi mynd magddiach gael gael siarad tron drwy dyfar hynny sy'n faram agos sy'n man hachad. Wel fo New Vava Gawa Bimdalmach son Koorst, Tim Hill Baltin on the show. Halish Napoleon a Koorst fast nas an Koorschen go fatas laat dan Hanish show Noshach ach ama feine mach skupdal Tim Hill. A Koorschen Vikama Dulich har Napoleon ach Gudder bin bewes. We take voor van mijn wen, van mijn gewoon, agus mijn hoogjen, agus als een magadief, agus aan mijn show haast.
De Gallison ga kusje naar bear, a gaan oorsan naar bewissen.
Van hier zaken, van mijn neef was een schaar is jij, kort, davlione, van pischig moeder niet in aram, agus. A mi fan yr asgo I dde gwbeth na mae fanollt am yr eist agos fa siorgi an y môr an ffif yn neud a mi ni sgwth e pilich yn efo mi gol agos a mi smech gwrw ma fi gyma ffas crys o'r wrth fa ma stan I gynhynys stoch sy'n asgo 80% so mi ffaddoch fi'n gyma doel agos Noors en han ik roet een hele naam we volgens mij ergens bij januari ergens een route naar schön geht wat ma zo hoe elkaar ach wat oorlijk en lo ergens gemaal boas zijn route schön horsig in hinne se chinara
Agus ha Sean idashek fordom agus a gimen noedelen.
Heringen ten ik slantje agus surse van Chinius or a geicher nu gaak min alhei. Hebben ni go eentje gemenetjach maar a geimen fouwes. Ach gendro tuig kormen achem of I dolle mui of I gien en nichen et er heiligje. Agus gutje jirach gun nach bromi fehef synú nach fat na húna. Ha mis sé fergin go mi go láir sa bha mi riamh. Ach chaténig sin orm go lua. Ha mi fergin mar bha mi in éidir 90%. Nuair a chaimim fewas an táiseach. Ach har a bhliana a station raim mé tuigh gursich agus va mi céinteach gon buring go dal an fewas go dhéir agus ha mé smuoking gin tuk sin cór gon buring go na néchan a dhéanamh mar raimiad agus mi dhearach hall buring go an un hearsa rúta dhéanamh a raimi misró emiacham.
As y darn y páist gan dŵl ag trwsig yd ME, clynnu sy'n folwch science a ha gwybod yd y genius.
I think one of the most important phrases in this area is I don't know. And I think anyone who claims to have a clear understanding of what happens when someone goes into an ME state really ought to think twice.
It became abundantly crystal clear that several of the patients had developed the syndrome, the identical syndrome, but they had developed the syndrome not following a viral infection or another infection, but due to their reaction to a particular form of stress.
Like many doctors, I thought this was either a non-existent illness or was all hysterical nonsense. I was at medical school in the early 1970s. I was taught by my superiors that this was in actual fact hysterical nonsense.
Agus, bysyn lenten Alison agus Kim, zat het al vollistige kounsbedjig a geë groeige let dochterd alappenig.
I think anything that helps anyone is good. If you're looking to recover from it, then I'm afraid the recommended treatment currently of CBT and pacing doesn't make sense even in the studies.
Ha mi nóchas nach gon opticha. So ag optich seo sé hétinge bí mi am hétinge vi skís an hoting eile me dhéon seo bechuile sin be vi a chud amach gomór gnneannach a féim.
There is a reasonable degree of evidence that acupuncture can help with pain. On the other hand, I feel much more cautious and much more reluctant to recommend to a patient that they should go off and spend, say, £500 on some sort of new talking therapy for ME which has not been subjected to any form of clinical trial.
So far, the establishment is just saying, go away and live with it, and if you want antidepressants, here they are. The establishment and the way things go at the moment hasn't served me. So I'm getting on with it as best as I can. And if it all fails, if this doesn't work, well then, yeah, I'm back to square one, and I'm going to feel a bit foolish. If it does work, then I'll be skipping down the road.